Store Stem Cells Save Lives by Group 7.
By Arden Thornquist, Isabella Menendez, and Yi Liu. After watching the video, we mutually decided on the topic of stem cell therapy. Learning more about this innovative technology can help us understand how this therapy functions in reducing overall healthcare expenses by affecting chronic diseases.
So, what even is stem cell banking? What first comes to mind may be something similar to the images on the left side of the screen, but what stem cell banking truly is the process of collecting, processing, and storing potentially life saving stem cells for future use in therapies and regenerative medicine. The diagram on the right side of the slide depicts this definition. These banks store stem cells for individualized use so that the cells are specifically tailored to each individual from whom the samples were taken. Stem cells can be harvested from both body tissues and embryos. We can multiply the stem cells to create more of the same, or we can transform them into more specialized cells, such as erythrocytes and myocytes. This is possible because adult stem cells have more plasticity than previously thought and can, in some circumstances, contribute to cell types very different from those in their tissue of origin. This has suggested that patient specific stem cell therapy can be carried out without cloning.
Stem cells have been used to treat many pathologies and have shown to be successful in reducing effects of chronic diseases by slowing risk factors down. For example, cardiovascular disease is a chronic disease that is the number one cause of death globally. Historically, treatment of CVD revolved around managing symptoms of the disease. However, researchers recognize the limitations of this perspective. Hardened vessels cannot be reversed, and other treatment options should be considered. Arterial hypertension and atherosclerosis are risk factors affecting CVD, so stem cells usage targets different blood vessels. Stem cell repair and regenerate vessel walls that are affected by the stiffness. In treating CVD, stem cells are taken from bone marrow and specialized into heart cells or vessel cells that then replace the damaged cells. Since stem cell therapy is a form of regenerative medicine, the focus is on replacing and repairing using curative treatment rather than just relieving symptoms in the short term. This is effective and efficient as stem cells can be used to prevent further symptoms in the long run. This also reduces chances of hospitalization, continuous but ineffective treatment, as well as caregiving expenses. This graph shows how chronic conditions make up a majority of emergency department visits. The high prices associated with chronic diseases have a great economic impact. As the population continues to age, finding solutions to dysfunction and degeneration of tissues is integral in reducing overall costs. The increasing number of clinical trials helps bring awareness to curative treatment as well as clearing any existing controversies.
Despite the large surge in demand for stem cell therapies, they still remain very expensive to pursue. Even simple joint injections can cost nearly $1,000, and more advanced treatments can rise in cost up to $100,000 depending on the condition. Patients must do their research and ask as many questions as they can before financially committing to treatment. Make sure to know how many cells you are getting, where those cells come from, if they are viable, is the clinic or lab regulated, and ask for as detailed information to be provided as possible. Due to the nature of the laws in place, there are no forms of government assistance or incentives for any of these companies, unlike large drug companies, so the stem cell industry is left to provide treatment to patients which incur most of the cost. In regards to future application of stem cell therapy, eye disease has been a prime target for treatments. In particular, clinical trials using stem cell transplants to treat macular degeneration have shown promise, noticeably improving vision in a number of participants. Possibly the most exciting prospect for regeneration therapy is in situ tissue repair, where doctors would activate the stem cells already in our bodies to repair damage. This is incredibly appealing as it avoids the complications of introducing new cells into patients.
Certain spinal cord injuries have always been known as irreparable, since once a neuron dies, it cannot be regenerated. However, advances in stem cell research have developed a new technique that aid in identifying critical genes involved in controlling their self-renewal and differentiation. These findings suggest that intramuscular injections of stem cells could be a useful adjunct to nerve repair.
Why could it be seen as unethical to waive consent in using embryos that are de-identified? For instance, biological materials that are meant to be discarded during in vitro fertilization could potentially be de-identified and used in stem cell research. Number 2. How do you see barriers like strict regulations on stem cell research inhibiting the potential benefits of such a therapy?